Good Friday afternoon. Welcome to Special Report Afternoon Edition. Thank you to KC Securities for their sponsorship of the Special Report at 8 a.m. and 1 p.m. each weekday. Thank you very much to Daniel and the whole team over there at KC Securities.
TGIF, eh?
Yes. We're waiting for Ford. He's going to be there with Elliot and Dr. David Williams, who's the Chief Medical Officer of Health. I just got my ear that we have seen 2-Minute Timmy.
Oh, damn. I have a story about Elliot that I want to open up with quickly. Forget it.
We'll
be right back after Ford makes his announcement.
Well, good afternoon. Today is an exciting day for Ontario. Our public health trends are improving. For the first time in months, we're under 200 new cases today. We've hit a new record for testing this week, over 28,000 tests in a day, and still an overwhelming majority of these tests, about 98% to date, have come back negative. The number of long-term care homes in outbreak continues to drop, and their status across the broad is improving. And today, we are moving forward with stage 2 of our plan for reopening. It's all thanks to our heroic frontline healthcare workers, the collective efforts of every Ontarian, and our brave men and women from the Canadian Armed Forces who are extending their mission until June the 26th, and I thank you. Because of that commitment, dedication, and steady progress, our most vulnerable are safer and more people are headed back to work today in many corners of our province. In 24 regions across Ontario, from Chatham to Kingston, to Thunder Bay, to Guelph, barbershops, hair salons, and shopping malls are reopening as part of stage 2. Restaurants and bars in those regions are opening up their patios with strict public health measures in place. Whether it's the mom and pop shops or Main Street mall business owners, I encourage everyone in these communities to show their support this weekend and shop local. As promised, we'll have another update on Monday. And we know more regions of Ontario will join them very, very soon, especially if we continue to see these downward trends across the province. We want to get people back to work as quickly and as safely as possible and get our economy roaring once again. But we also know it's about taking steps to help people's lives get back to normal. Today, the limit on social gatherings will increase from 5 to 10 people. As of today, our places of worship will be able to reopen. And beginning next Thursday, our long-term care, retirement homes, and other congregate living settings will be able to start accepting visitors. We're finding ways to bring families and friends together again safely after being apart for so long. And today, we have more good news to share with the people of Ontario. We know there are friends, families, and loved ones who you haven't been able to hug or come in close contact with in months. And today, the public health guidelines will be changing to introduce social circles. Minister Elliott will provide more details in a moment, but this is a very, very important step forward. This change will expand the number of people who we can come in close contact with who live outside our homes. Social circles will allow family and friends to reunite safely while reducing the risk of exposure and spread. This means finally hugging a grandparent or sharing a meal with your parents or closest friends. But as we reopen and as we reunite, we must continue to remain on guard. And while we know some of the toughest challenges may lay ahead, I know we'll get through this together and come back stronger than ever before. Thank you, and God bless the people of Ontario. Now I'll hand it over to Minister Elliott.
Thank you, Premier, and good afternoon. On a day when most of Ontario is proceeding to stage 2, we reached an important milestone. The province saw the lowest day-over-day increase in new cases since March 28th. In fact, 28 of Ontario's 34 public health units added 5 or fewer cases, with 17 of them seeing no new cases at all. This is a remarkable accomplishment, and one that is only possible because of the collective efforts of every Ontarian to stop the spread of COVID-19. And it has not been possible without sacrifice, including and especially precious time apart from friends, family, and loved ones. With so much progress having been made, Dr. Williams, our Chief Medical Officer of Health, has updated public health guidelines, effective immediately province-wide, to allow for social circles of up to 10 members. Think of your social circle as the people you can touch, hug, and come into close contact with as we continue our shared fight against COVID-19. A social circle is made up of families and friends that you can interact with without the need for physical distancing. There are 5 simple steps to building a safe social circle. First, start with your current circle, the people you live with or who regularly come into your household. Second, if your current circle is under 10 people, you can add members. This could include family members you want to spend more time with, perhaps grandparents, or another household with similarly aged children. Third, get agreement from everyone that they will join the circle. Fourth, keep your social circle safe. Maintain physical distancing with anyone outside of it. And fifth, be true to your circle. No one should be part of more than one circle. After months of battling COVID-19, social circles will help people struggling with isolation. They will also help provide more support for the people who need it, including more childcare options. Social circles will also enable Ontarians to enjoy close contact by dining together at home, outside, or on restaurant patios with other members of their circle. But I do want to be clear. The rules for social circles are different from the recent expansion of social gatherings from 5 to 10 people. Social gatherings can be any 10 people from outside your household or circle, but where physical distancing of at least 2 meters must be maintained. For example, the expansion of social gatherings will allow individuals and families to enjoy the company of others at backyard barbecues and picnics in neighborhood parks while respecting physical distancing guidelines. Combined, and as we enter the summer months, there are now more opportunities for Ontarians to enjoy the company of others. I know many people are eager to reconnect with their family and friends, and we are just as excited to share this next step with you starting today. Thank you.
Okay, we'll go to the phone line for questions. Just a reminder that it's 1 question and 1 follow-up.
And your first question will be from Cynthia Mulligan at City News. Please go ahead.
Hi, Cynthia.
Hello, Premier. How are you today?
I'm doing really well. You know, I'm feeling good. We had 28,000 tests, and things are coming together. But I want to thank Dr. Williams and all the chief medical officers of health for the great work they're doing. I want to give another shout out to Matt Anderson. He's instrumental in getting these numbers up. So, but as I always mention to everyone, don't take your foot off the pedal. Keep going. You know, and they are. They're going to keep going. But looking forward to the weekend.
I think we all are. And geez, I hope that doesn't count as my first question, Premier.
No, you always get.
Okay. So my question to you is, in the past 5 days, the COVID positive numbers have gone down 44% than the previous 7 days. And I'm wondering if now that you see these numbers in this real low that we hit today, the first since March, do you think it was actually necessary to hold off on the rest of the GTA opening up today as well, along with the rest of the province? And do you foresee it opening up, you know, on Monday? You say you'll be reassessing.
Well, based on the numbers in certain regions, we saw certain spikes in those 10 regions, and I just asked people in those regions, please be patient And over the next very short while, we'll be able to open the 10 areas up very shortly based on the numbers in case there's a spike, because we have seen numbers go down and then spike up, but this is pretty low. I have to admit, these are really positive numbers, but we can't let our guard down for a second. But just those folks, please be patient, and I know we'll have some good news very shortly for you.
Follow up.
Okay, and these previously known as family bubbles, now known as circles.
Welcome back. Thank you for being here and watching the afternoon edition of TGIF again. In case you missed it, it's Friday, and we're really happy about that. Okay, so Christine Elliott, as you know, was tested for COVID-19 and missed Tuesday's press conference.
Yes, she missed the press conference, but apparently she didn't miss her booze.
She didn't?
No.
Look at this picture right here, courtesy of CTV. We see her. She's just perusing through the vino collection. Now, to be fair, the woman deserves a few bottles of vino.
But doesn't she have like assistants?
Well, there's tons of
she's the deputy premier
with
and
whom she could have
the health minister. Yes. I'm sure there was an intern available somewhere to go buy her some wine.
Yes. Now, but so she, but she has been telling everyone, you know, once you get tested, and you think you know, obviously if you get tested, there's some doubt in your mind or there's some worry that, hey, crap, I might have COVID-19. Maybe I should go home and not go to the liquor store. You're supposed to isolate
until you get your results back.
Practice what you preach, Miss Elliott.
Guidelines provided by her ministry, actually, of all the funny places those guidelines could have came from.
Just kidding. I mean, the person taking the picture must have been like, is this happening? Like, what the hell is she thinking? Okay, moving on from Miss Elliott. Other than that, her wardrobe's looking better and she's doing a great job.
Yeah.
Okay. The advocacy for family reunification at the Canadian border. I just want to address this. Okay, so there was an announcement made earlier this week that they're looking into it and blah, 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 and they were trying to work together. Maybe we discussed how out in Vancouver, between Washington State and Vancouver, they have
a park there?
A dead man zone kind of thing that's I'm not too sure if it belongs to the U.S. or Canada. It's just, it's a gray area. Let's call it a gray area.
It's a gray area that we don't defend too strongly.
Right.
Yes, so on either side of the border.
They can meet up with their loved ones at that park. There's definitely people here in the Soo who have loved ones across the river. Isn't that what they say? I'm used to saying across the border in Southern Ontario. So across the river, they have people they want to go see, loved ones they haven't seen since March, obviously.
March 21st, yeah.
Okay, so we will continue to, you know, advocate on your behalf and bring that to the attention of everybody watching. But we did learn today that you can fly to the U.S. I understand how ridiculous this sounds.
Yes.
That you're 20 minutes away from your loved one. And obviously we don't fly the Soo Airport, not the hospital.
The hospital's not flying anywhere.
Yeah, you don't want to take.
Pretty grounded.
You don't want to take any flights from the hospital from here. That would be Orange Air, and you don't want to fly Orange Air.
Yeah, you don't really want to fly in the Orange helicopter.
No. So you can drive to Toronto, take a flight across, which is absurd. So we'll do July 29th, I think, is when the airports here are closed, so our borders shut down till.
Yes.
We understand, and the borders, like.
The border's going to be shut down until late July.
Yeah, I think that might be the 29th as well.
Yes.
So we will continue to bring this issue to the community, but that's an alternative. And Chris has got a great story about that, and they have changed some guidelines because we can fly. So the Canadian government announced today that when you do fly, you are going to be getting your temperature taken at the airport.
And they're actively screening, basically.
Yes. Yeah. Now, I don't know if you know, but what about masks when you're flying? Are they making that mandatory?
I would yes. Most airlines have it as being mandatory, yes.
And another question. I ask Chris everything. You can tell me. We forget about you. Sitting beside each other, the social distancing?
No. The center seats are gone. So you're going to have the row seat and the window seat, but the center one, there's no one sitting in. Same in the center of the plane if it's a larger plane.
He has the answer.
So yes, the center seats are all not available.
Okay.
But I did look, and like I used to live in Miami, and I could fly later today to Miami for $329 on American Airlines through Philadelphia, and be there by about 8 o'clock tonight. So it is possible to get a flight.
Well, it's better than what the weather shows us. Maybe we should go to Miami.
Oh, yeah.
Come on, give us the weather, Chris.
Yeah, this is not the Miami weather.
No.
If it was, they'd be like freaking out. It's 8 degrees Celsius right now here in the Sioux.
Yeah.
We could get up to 12, back down to a low of 4. Tomorrow, sunny and 19 as a high, 7 as a low. And then on Sunday, 23 high, 11 low. So we are trending in the right direction of summer temperatures. But 19
Really?
isn't exactly
That's spring.
boiling hot. And next week, by the middle of the week, we should be in sort of mid to high 20s again, which would be nice since we haven't been there for a while.
Bring the humidity back.
Well, bring heat period back. Like, I don't care if there's humidity, just get me over 25 at least.
Let's be positive and be thankful that
Yeah.
the sun will be shining in the sky this weekend.
It'll be shining, it's just not going to be too hot shining.
Well, I'm making it a beach weekend regardless. That's what I said last weekend. But anyways, we have a lot of more news for you coming up. We have a lot of government funding. We have a terrible story out of
Yes.
Toronto about a police officer involved in an underage human trafficking ring.
Yes, that's very weird.
Oh, and he's out of the 51 division, which is from the downtown core, the
Yes.
busiest police station in downtown Toronto, as far as I'm concerned. And we are going to be right back after this commercial break with all those stories.
See you in a minute.
A message from the Government of Canada.
In your home, lighting is just as important as style.
With PowerView Motorization from Hunter Douglas, you can schedule your shades to light up the room. Create privacy, or both, automatically. No hands required.
So your shades will always be in the right place at the right time in style. And it's only from Hunter Douglas.
What's life without making a few mistakes down the road? A few sharp turns. And doing things for what we adore, but might regret later. A trip to Chuck's Roadhouse isn't one of them. With melt-in-your-mouth AAA steaks, buttery lobster tail, half-priced apps after 9 p.m., an ice-cold draft with all your Roadhouse favorites. Chuck's Roadhouse. Food the way it ought to be, priced the way it used to.
And welcome back to Special Edition, afternoon version. And we got a couple of Facebook shoutouts. We have hi to Jeff, Tammy Lynn, Erica, and Emma. Thank you very much for watching us
Emma,
on
hi.
Facebook.
They're always on there, Tammy Lynn and Erica. Thanks, guys, for always watching. We
good
appreciate
afternoon.
it.
Have
And
a
hi, Jeff.
fantastic weekend to you all.
Yeah,
if you
for
want
sure.
to interact with us live on the show, the only way to do is actually through the Facebook chat. That's the one we watch during the show here. So if you want to send us birthday shoutouts, anniversaries, or any other big things going on, or you have any questions,
Kids leaving.
Yeah, kids leaving. That's a big one. I know from my parents, anyways.
I kind of feel that. I get that. Just by, knowing
they
you
had
for
a
the last
massive
couple of
party.
months.
Yeah. After I left, but
Well, yeah, obviously. Your room was transferred into
I wasn't invited, so.
That's hilarious. Your room was transferred into a shoe room.
No, their dog got it.
Oh, did they?
Yeah.
Okay, I've got some news here. So, so two of Canada's largest grocery stores, that's Metro and Loblaws, they were paying their employees a premium for working through COVID-19 since mid-March. And actually, I want to give you the proper numbers here. It was an additional $2 per hour since mid-March that they were paying their employees who continued to wanted to work. I think they had the option to. A lot of people at the beginning, they had to downsize some of their staff, but I thought that was a great initiative. And Galen Weston, he is obviously, everybody knows that name, and he is the executive chairman. He is saying now that things have calmed down, he's decided to take that premium away, and that will happen as of Saturday. So if you work at Loblaw companies or Metro, unfortunately, you won't be getting that extra $2 an hour anymore. And in keeping with food, the Ontario government is investing $1 million to improve access to healthy meals and snacks for school-aged children. So when you send your kids to school, you always get, you know, they have the option, if needed, to have some healthy foods. Now, because school was canceled, oh, look at that Nutella and banana, that's delicious. Sorry, the Student Nutrition Program has had to find new ways to support families. So they've had all that money, the funding there, so that since March, right? So March, April, May, June. What are they going to do with that money? They are looking into other ways for this nutrition program. But over the past few months, the program has been adapted to include new local approaches. So they have been going to the food banks, they've been delivering it there and helping out. So they've been doing that already. So if you are in need of some healthy meals, know that the government is helping you and will be there at your local food banks. Over to Sault Area Hospital, they had received a nice little chunk of change today. Why don't you tell everybody about that?
Just short of 1.9 million.
How much short? Come on, I like
about
this.
$100.
100?
Yeah.
Come on, just give them $100.
Like, talk about a rounding error. Okay, so they got it's a 1.3% increase into the hospital budget.
Okay.
The main part of it is 1.1 million just to help with ongoing operational expenses. So that's about a 1% increase there. In their ongoing operations. This can be used in any way they want other than it's ongoing operational, so they can't go out and hire new staff, but they can do it to put in more procedures and so on. And then specifically there was $800,000 for cardiac care services. So there is a, if you need any cardiac care, almost half the money is going into cardiac care and the other is going to other types of operational expenses that they have. Because we do know that we're over 100,000 surgeries and procedures behind in Ontario because of COVID-19.
Yeah.
This is additional funding to help them be able to go out and do more services to try and make up for that backlog. And because of that backlog, obviously there's a massive fund announced across Ontario, $594 million. This is the Sault Area Hospital's part of it to try and get through that backlog. I mean, we already know we wait long enough for stuff in Ontario when you need to wait for healthcare in the first place, but now there's this backlog. This will actually help them with hundreds and hundreds of procedures that they can now do that they didn't have the funding for before.
Good. That's great.
Now, unfortunately, with the way this money is funded, it actually can't be used to go out and hire a new doctor, but it can be used to pay the existing staff or any of the associated costs with doing a certain procedure.
That's too bad. We need doctors in this too.
Yeah. And I was on that call. Ross Ferman, our MPP, was obviously on that, and so was Wendy Hansen, who is the CEO of the Sault Area Hospital. She was on that call as well. That is a rare public appearance for her, so that was nice to see her actually out there at the announcement. Okay, so we're going to talk a little bit about travel. As everyone is aware, particularly in this town, the border has been closed for quite some time. This since March 21st to be specific. However, since May 22nd, Air Canada and several other airlines are now flying to the US. So you can actually fly to the US because the closure of the border is only for land travel. It's not for air travel. So there are people, if you want, that have been going on airplanes and traveling down to the US. And this is actually someone went to the border and the U.S. Customs and Border Protection officer said, "Have you thought about flying?" And she said, "Well, no." And he said, "You might want to look at that." So she did. And then U.S. Customs and Border Protection said that travel restrictions apply only to Canadians trying to enter the U.S. at land border crossings, which includes travel by car, train, ferry, and pleasure boats. However, Canadian air passengers can still enter the country as long as they haven't visited Brazil, China, Iran, Ireland, the UK, or 26 European countries in the past 14 days. So you can actually go to the Toronto airport and fly to the US. I mentioned a second ago I looked at I used to live in Miami. I could actually go later today, get a flight around 3:30 from the Toronto airport, go to Philadelphia, and then on to Miami, and I could be there by about 8 o'clock this evening.
Okay.
I would have to magically transport myself to the Toronto airport in about 2 hours to get my flight, never mind having to go through security.
Yeah.
But if
However,
I wanted to, I could go and get a flight even today.
Okay, but so I'm going to Miami. It's
Yeah.
all that's going through my head right now.
Yeah, that
Don't
was
tell
actually
me it's
my
not going through
ringtone
yours.
for a while.
Of course it is. But, okay, so earlier you were saying if you made that stop in Philly, you could get your favorite what?
Philly cheesesteak.
Yes.
I used to fly a lot.
Yeah.
My old job I used to do sports
Yeah.
events, and I would always try and fly through Philly because one of the two famous Philly cheesesteak places actually has a place in the airport.
Okay.
So
Does everybody now want a Philly cheesesteak?
Yeah, I mean it's way better.
Even
I don't know how to describe it, but in the States, the bagels in New York are completely different from
I've
the
heard that
Yes,
too.
it's from the water table.
Okay.
So they're not thick and
So
dense like all
informative
the
you
other bagels. The ones in New York are like nice and fluffy. They're fantastic. So that's very nice. If you
I'm
can get
starving.
go
Stop
through one of the
talking
New
about
York
food.
airports, you can get the good bagels. If you fly through Philadelphia, you get a Philly cheesesteak, so that's nice.
In Chicago, do you get a deep dish?
No, but I have been to
You
the
should.
original deep dish place. And you're not going to believe this. And guess how long it takes to do a
I
deep dish pizza?
guarantee you I'm not going to believe this. Huh?
It takes over an hour to cook a real deep dish pizza.
God, that dough must be pretty yummy.
It is thick. I mean, one slice and you're full for 3 days.
That's gross. Okay,
it's
now I'm
it's
not
like
hungry.
this
Thank you
thick.
for
It's like
adding
literally like 6 inches.
That's gross.
Yeah, it's crazy.
Okay, well, like that's a bad segue into my story here, but I don't
Well, now we're
even
going to talk about health foods.
No,
There's the segue.
No, we're going to talk about this crazy corrupt police officer in the
Oh,
downtown core.
yes.
What's up with this guy?
Division
So-
51, right down by the AGO, Art
Right?
Gallery of Ontario.
Yes,
for those of you that don't know.
49 years old this guy is. He was in the police with the police services for 11 years. Okay, like there's just so much to this story. He's been charged of obtaining sexual services from a child under the
16,
age 18
yeah.
and 16, and
Yeah.
into the investigation.
Paid for services.
He paid for services, so he's involved in this ring
Yeah,
of
underage
human
trafficking probe, yeah.
What's up with that? Okay, but you know what really ticks me off?
Don't worry, we're not on CRTC.
Okay,
we
you
won't
know
get
what
a
really
fine,
pisses me off
$50,000
is
for
that
that.
this guy's still on the payroll.
Well, of course, he's innocent
He's
until proven
been
guilty.
suspended with pay. Why are you paying this guy anything?
Because he's innocent until proven guilty.
Well, I've already proved him guilty.
Yeah, well, I
Take
mean,
one,
he's probably guilty. He'll probably plead out something on that, but yeah.
Well,
He wasn't
listen,
part of the actual human trafficking part. He was just a client, though. Yeah.
he's still a part of the ring.
Yeah, I mean,
it's
yeah,
still.
I'm not defending him. I'm just saying he wasn't an active. He wasn't an active part of the human trafficking. He was just a client, but.
No,
it doesn't excuse his behavior.
I mean,
but
you're privy to what's going on. You're
Yeah.
protecting and serving. That's you protecting and serving.
Yeah.
Don't get me started. Get him off payroll right now. 51 Division. Come on. Okay, I brought up a while ago the black box from the jet that was shot down.
From Iran.
If I could find the story, it'd be a lot easier to tell you about it. But Transport Minister Mark Garneau says that Canada is eager for Iran to follow through on returning the black boxes. So
Never
if you
gonna happen.
recall, so back in March, they had a 2-week timeline to send the black boxes to North America, to Canada, and to the other countries who were involved.
Yes.
And off the top of my head,
I think
can't
there's
remember.
about 18 countries or
yes,
so
there
people
was
on the
quite a
plane. Yeah.
few. And several Canadians perished in that
Yes.
that accident.
More Canadians died than any other country on that plane. Yeah.
So our Canadian government has really been pushing to get these black
Yes.
boxes. Okay, so in March, Iran said, yeah, we'll send them in 2 weeks. They had a deadline. They had an agreement, a written agreement.
Iran
Time has
even
passed.
admits that they shot it down with their own missiles. They're not even denying that.
Right.
It's like, oh, human error.
So
well,
time
that's
has
quite
passed.
a big error.
So more than 90 days later,
Yeah.
the boxes still remain in Iran, Chris. And
It's never coming.
Yeah, Paravesh tells the Canadian press Iran is now going to bypass Ukraine and send them directly to France as soon as the parties that want to be there can travel. So they
Sure.
okay, whatever. So I don't understand what takes so long to send a black box. They had blamed it on they were too busy with COVID-19. So that's
Okay,
just
well,
that's just not
Sure,
good.
Iran, we'll buy that one.
Yeah, but anyways,
Alrighty.
speaking of time, we're out of it. Have a
Yeah.
great weekend, Sault Ste. Marie. We'll see you on Monday.